Hello, my name is Santana, and I'll be presenting part one of my case study. I'll begin by going over a little bit about my client and some of her demographics. So to begin, my client is a 5-year-old female who lives in California with her mom and 3 older brothers. She was diagnosed with ASD level 3 2 years ago. Last year, she started receiving 40 hours ABA therapy per week, and she has continued this recommendation since then. Assessment scores reflect a developmental age of less than 3 years old and a mild to moderate symptoms of ASD, according to the Vineland and the CARS 2 ST assessment. She communicates using 2 or more word approximations, and I wanted to note that she does not have any medical conditions or take any medications, and the behavior of concern include tantrums. So I'll begin by going over the assessments that we used to help us figure out where she's at with her deficits and barriers, as well as the functions of her tantrums. So for starters, I wanted to point out the VB-MAP barriers assessment. I chose this one because the VB-MAP displays a wide range of early skills for my client to master. So in the barriers assessment, she demonstrates 48 out of 96 barriers that were assessed in the assessment. She scored 3 out of 4 in behavior problems, which indicate that she emits more severe negative behavior daily, such as tantrums, throwing things, and property destruction. And 3 out of 4 in obsessive compulsive behavior, which indicates that she has several obsessions that may emit negative behavior, and she will often not comply without completing the obsession, meaning that she won't comply until she's getting what she wants or until she's able to escape from her demand, or a demand, I should say. Therefore, her learning is disrupted. I also use indirect assessments such as the motivation assessment scale and the questions about behavior function rating scale to help me determine the function of her behavior. So for starters, the MAS is an indirect functional behavior assessment designed to identify the motivation for target behavior. The total score reports the number of items scored for that function, and the highest total score indicates the likely potential sources of motivation for the behavior. The QABF is kind of the same. It's designed to identify a number of factors that may influence the occurrence of target behaviors. And for this one, the highest score, the total highest scores indicate likely potential sources of reinforcement for the behavior. I'll go over her results of these indirect assessments. As you can see, tangible was scored the highest, and then escape from demands or non-preferred tasks and activities was scored second, and even attention was scored third. We found that she does not engage in tantrums for any sort of sensory needs or any physical, like painful kind of needs. So yeah, the assessment was able to help us determine a hypothesized function, which is access to tangibles, escape from non-preferred tasks and activities, and for attention. So based on these results, we were able to come up with an operational definition, as well as with collected data and ABC data. We came up with an operational definition, and I'll go over what we came up with. So her tantrums are defined as engaging in yelling at a volume above normal, climbing items, putting non-edible items into her mouth, disrobing or attempting to disrobe, and swinging items around in a circle, such as her chewy or toys, and crying with or without tears. Tantrums have been reported up to 6 times per day, both at the clinic and at home, and they may last as long as 20 minutes. Reducing this problem behavior would optimize the use of her functional communication, the opportunity for her to build friendships, and her readiness for school. She will be starting school in just a few months in the fall. So this is a highly prioritized behavior at the moment. And that is her tantrums. I'll go over some of the relevant BACB task list items that were relevant to this case study. So for starters, C1, establish operational definitions of behavior. I was able to do this after collecting all my indirect assessment results and my data, as you saw in the previous slide. F1, review records and available data. I was able to do this by reviewing her intake assessments and reports, her diagnosis report, And just some of her data from before I was on her case gave me a little bit of information of how we can move forward from there. Next, F3, identify and prioritize socially significant behavior change goals. After assessing the VB-MAP, particularly, this one gave me the best ideas for new goals for her to work on. And then next, describe the common functions of problem behavior. I'm pretty familiar with the functions of behavior and being able to describe them. And we saw them in our indirect assessments. Next, of course, interpret a functional assessment data, which is F9 in the task list, by assessing all three of the assessments, I should say, and writing the results and figuring out what to do from there helps me to interpret the best way for me to help her behavior. And next, H2, identify potential interventions based on assessment results. Again, I was able to do this after collecting data from the VB-MAP assessment. This one gave me the best idea of where her deficits are and what I could target based on the missing areas in the domains. And lastly, when a target behavior is to be decreased, select an acceptable alternative behavior to be established or increased. Oh, I should have mentioned this. As an alternative behavior, we have been redirecting her to get a preferred item or reinforcing item from a supervisor's office at the start of her wanting an item from a peer. For example, when a peer has an item she really wants, but is denied access to it, she may begin to follow them with her arms out, trying to reach for the item. Before that, she's immediately redirected to come to a supervisor's office and pick out a toy that she can engage in as an alternative. This has been helping to decrease the duration of problem behaviors and also the intensity. And that is my presentation. Thank you for listening.